Hello everyone, today we will discuss disorders of the immune system. During our discussion we will cover the following objectives. We will distinguish between congenital immunodeficiency and AIDS, give the name of AIDS virus, describe steps involved to have AIDS, state the routes of contamination with HIV. First we will start by observing these two armies. As you see in these figures we have two different armies. What do you think? Which army will be able to defend his country and justify? It's easy to tell. This army for sure, since it is a strong, efficiently defending and well-organized army. And similar to this army, the immune system should be to stop diseases. But sometimes disorders of the immune system occur. In some cases, the immune system is too weak and unable to efficiently fight infections, while in other cases, the immune system is too aggressive and attacks harmless elements of the environment. When the immune system is too weak and can't fight infection, it is a case of immunodeficiency, while when it is aggressive and attacks harmless elements, it is allergy. We are going to talk mainly about immunodeficiency. There are two types of immunodeficiency. The first type is congenital immunodeficiency and the second one is acquired immunodeficiency. An example of congenital immunodeficiency is bubble boy disease, and an example of acquired immunodeficiency is AIDS. And we are going to discuss it. Now we will start with congenital immunodeficiency. The word congenital means that it is present at birth, which means that the baby is born with immune system disorders. In this case, leukocytes are non-functional and can't stop infections. Leukocytes are white blood cells responsible for identifying the pathogens and destroying them. When leukocytes are not doing their function, then the immune system can't protect the body against pathogens. So this baby cannot live in a normal environment. Instead, he must be put in a sterile cabinet. Sterile cabinet means an area free from microbes, and that is to prevent any contact between pathogens and the immunodeficient baby. This is a temporary solution in order to avoid contact with pathogen, but the solution for this baby or the treatment for this baby is to have a bone marrow graft. Why is that? We all know that the bone marrow is the site of production of all types of white blood cells, and in case of immunodeficiency, the white blood cells are non-functional and can't stop infection. So in this case, a bone marrow graft will provide new functional bone marrow tissues that are able to produce all types of leukocytes. The leukocytes produced are functional and can fight pathogens and stop infections. Now we will talk about the second type of immunodeficiency, which is acquired immunodeficiency syndrome, or AIDS. In this case, the infection appears later during life, which means that the patient was healthy before getting infected with the disease, and he was born healthy. This disease is caused by a virus, and the virus causes degradation in the immune system, which means it reduces the immune response. Thus, the patients suffer from opportunistic infection, then death. What do we mean by opportunistic infections? Opportunistic infections are caused by opportunistic pathogens. What do we mean by opportunistic pathogens? Pathogens that normally can't cause disease, which means that opportunistic pathogens do not infect healthy individuals, can't cause a disease in a healthy individual. But these pathogens take opportunity of the weakness of immune system in order to develop, which means that they infect a weak immune system. So we can say that pathogens that cause disease after degradation of immune system. What is the virus that causes AIDS? Acquired immunodeficiency syndrome is caused by a virus called the human immunodeficiency virus. Here, pay attention for the names. The disease name is acquired immunodeficiency syndrome, and the acronym is AIDS. Virus name is human immunodeficiency virus, and the acronym is HIV. Pay attention for the names and acronyms. So now we know that HIV causes AIDS, but what does HIV target? Which cell of the body does HIV infect? Watch this video please in order to find the answer.
When HIV infection occurs, the virus targets these cells of the immune system. The virus attaches and gains entry into the Cd4 cell and replicates itself or makes copies of itself. During this process, infected Cd4 cells die, and the HIV virus seeks out other Cd4 cells to infect. The body is left in a weakened state of defense against infections and is susceptible to diseases. The lymphatic system extends throughout the body and is part of the body's immune system defense against infection. When HIV enters the body, it establishes itself in the lymphoid tissue. Circulating CD4 cells are targeted and infected by the HIV virus lying in wait. The result is that the CD4 cell count in the body decreases as infected cells are destroyed by the HIV virus. The characteristic feature of HIV infection is the decline in CD4 cells. As such, CD4 cell counts are commonly used to monitor the progress of HIV infection. However, declines in CD4 cells in the bloodstream can take several years to reach very low numbers. Healthy people have between 600 and 1200 CD4 cells in a cubic millimeter of blood. When CD4 cells reach low or very low levels in the bloodstream, patients are at risk for getting serious infections or cancers. These are called opportunistic infections because they take advantage of the body's weakened defenses. Once CD4 cells fall below a level of 200 cells per cubic millimeter in the bloodstream, or if a person has an opportunistic illness, this is considered an advanced stage of HIV infection.
After watching the video, we figure out HIV targets or infects T4 cells, which are also called T helper cell. The infection of T helper cell with the virus leads to their destruction, and as a result, the number of T helper cell in the blood will decrease. The decrease in the number of T helper cell leads to less efficient immune response, resulting in infections with opportunistic pathogens. Finally, it ends with AIDS or acquired immunodeficiency syndrome. Here we should remember the role of T helper cells or the function of T helper cells. Don't forget, T helper cells identify the pathogens and activate specific immune response. So the infection of T helper cells with HIV virus leads to their destruction and the decrease in the number of T cells. As a result, the decline in T helper cells stops the activation of specific immune response, which leads to degradation of immune responses. Now please answer parts 1 to 9 in worksheet 14. Now please watch this video in order to find out how is HIV infection diagnosed.
To diagnose whether you have been infected with HIV, a blood sample will have to be taken for testing. Tests performed on your blood sample will look for the virus itself, or specific markers called antibodies that indicate that the virus is present. Antibodies are special proteins produced by the body's immune system to fight infection when HIV enters the body. If a person has HIV-specific antibodies in their blood, it means they have been infected with HIV.
Then, how is HIV infection diagnosed? After infection, HIV starts attacking T helper cells. As a result, B lymphocytes secrete anti-HIV antibodies into the blood. In the hospital, special tests are done to detect the presence of anti-HIV antibodies. The detection of these antibodies indicates the infection with HIV. Then the individual is considered to be HIV seropositive. HIV seropositive means the presence of anti-HIV antibodies in the serum of the individual. Now please watch the following video in order to find out the steps of HIV infection.
Treatment by a doctor or nurse will go through the following stages. Acute HIV infection. At some time during the first month or so after HIV enters the body, a person may have a flu-like illness. Symptoms may include fever, fatigue, rash, headache, swollen lymph nodes, and sore throat. Some people have no symptoms at all. The viral levels at this time are very high because at first, the body is unable to fight the virus. During this time, the HIV antibody test is negative. This is called the window period. Within about 1 to 2 months, the body begins to produce antibodies to fight the virus, and viral levels drop. The rapid HIV antibody test detects these antibodies, not the virus. A blood test can be done in the hospital or clinic to measure how many Cd4 cells a person has. This test is called the Cd4 Count. During this time of acute HIV infection, the Cd4 count goes from a normal level of 1,200 down to about 900. The viral levels at this time are very high because at first, the body is unable to fight the virus. Within about 1 to 2 months, the body begins to produce antibodies to fight the virus, and viral levels drop. After the initial infection, the body can effectively fight the HIV for about 5 years. This period is called Stage 1. During this time, the CD4 police cell levels drop from about 900 to 500. At the same time, the HIV levels in the blood slowly rise. Although generally symptom-free, a person in this stage can still pass the virus on to others. From about 6 to 9 years after infection, a person is in stage 2 of HIV infection. During this phase, the Cd4 count may go down from about 500 to 350. At the same time, the HIV levels in the blood slowly rise. Swollen glands appear in the neck, armpits, or in the groin. A person may feel weak and tired and experience fevers and weight loss. The number of CD4 cells is now so low that other germs that cause infections find it easier to invade the body. This makes it so flus, coughs and colds, skin rashes, shingles, fungal nail infections, and mouth sores become more common in this stage. After about 9 to 11 years of HIV infection, the CD4 count drops below 350 and the person enters stage 3. HIV viral levels continue to increase. In addition to all earlier symptoms listed, a person may have abdominal pain, ongoing diarrhea, congenitals may happen again and again. Within about 11 or 12 years of HIV infection without medical treatment, a person enters stage 4. Another name for stage 4 is AIDS. The CD4 count drops below 200 and the body begins to lose its long battle against HIV.
From the video, we conclude the following. At the beginning, HIV infection is unnoticed since there is no symptoms or signs of the infection, but still the individual can transfer the disease to others. As we said before, HIV targets T helper cells and destroys them, leading to the destruction of the immune system. The end stage of HIV infection is AIDS, leading finally to death by opportunistic infection. By observing the following graph, you notice that the level of immunity was high at the beginning of the infection, then this level decreases with the increase of HIV concentration. After that, there is a mild increase in the level of immunity due to the secretion of anti-HIV antibodies by B lymphocytes. Then this level will decrease to its minimum with the increase of HIV concentration. Now observe the following figure, knowing that the blue cells represent T helper cells and the red particles represent HIV viruses. As you see, T helper cells are decreasing while HIV viruses are increasing. This is because HIV viruses are attacking T helper cells and killing them. At the end level of AIDS, there is the minimum number of T helper cells. Thus, the body is not protected anymore and it ends with death. Steps of HIV infection. First, we have contamination with HIV. HIV targets T4 cells or T helper cells and start destroying them, leading to destruction of the immune system. As a result, leading to AIDS or acquired immunodeficiency syndrome, which will end with death. Routes of contamination with HIV or the ways of contamination of HIV. How is HIV transferred from one individual to another? HIV is transferred from HIV-infected mother to her fetus. It is transferred by the use of contaminated needles with HIV. Transfusion of contaminated blood, a transfusion of blood from infected individual to a healthy individual. And also by sexual relations. Now please answer parts 10 to 14 in worksheet 14. Thank you for watching and good luck.